You're listening to the True North Success Podcast. Real stories of personal, professional, and financial wins from Alberta's best. With your hosts, Gary Ma and Amy Kim.
Hey everybody, welcome to the show. Today my special guest is Dr. Emmanuel Gye. He is a family and lifestyle physician and founder of the Alberta Lifestyle Clinic. With over 20 years of experience, he specializes in preventative and precision medicine, helping high achievers and organizations extend their health spans through evidence-based wellness strategies. As a prominent healthcare leader, Dr. Gye serves as a clinical associate professor at the University of Calgary and sits on the board of Health Quality Alberta. He also holds a charter director designation in corporate governance and is a dedicated community volunteer. It is my pleasure to have Dr. Emmanuel Gye on the show. Welcome to the show.
Thanks very much, Gary.
So, Dr. Gye, I gave a quick overview of your success, but can you fill in the details of what you do, who you serve, and how long you've been doing this for?
Absolutely. So I'll just highlight, my name is pronounced Gye.
Gye? Okay. Sorry about that.
You provide the Anglophone, but that's totally fine. I'm used to the Anglophone pronunciation, but I thought I'll just highlight that. Yes, so I've been living and practicing in the Airdrie area. I live in Calgary, but I've been practicing in Airdrie for the past 16 years. Initially as a family physician, and then transitioned just post-COVID to lifestyle medicine, and focusing in my community of Airdrie and surrounding, including Calgary, of course. We've been doing that now for the past 6 years now. We founded the Alberta Lifestyle Clinic, or Alberta Bariatric and Lifestyle Clinic, with that sole drive. And we've been looking after clients who self-identify, and we're covered through the provincial health system. So you're not needing this. Cost is not a barrier. We're open and available to any and everybody who wishes to take advantage of this medicine practice.
Yeah. So can you tell me a little bit more about what lifestyle medicine is?
Absolutely. So lifestyle medicine is an expanding, I won't say emerging, it's an expanding field of practice. It's a subspecialty that covers everybody. So what traditional training is, we refer to as allo medicine. And lifestyle medicine goes to the root cause of what makes us sick. And the fact is, there's a general perception that we are doomed to develop chronic disease. Our genes have done it to us. But what lifestyle medicine has pointed out is actually it's not quite the case. What we're dealing with is a mismatch between our nature and our genes and the environment we've put ourselves in. And I use the emphasis putting ourselves in, because we do have humans on the planet who completely buck the trend. You have in the modern society, the 5 blue zones that have been identified. And there's also questions about Singapore becoming or is as blue zones. And these are communities where people outlive and out health span the rest of the population around them. And you notice that they do certain things in common. And then also, if you look at the environment where people live what we refer to as the natural health lifestyle, I'll use 2 examples. There's the Tsimane in Bolivia. They have, I'll call them the cardiovascular masters. You get an 80-year-old with 0 arterial calcification or the blood pressure of a 50-year-old. So the incidence of cardiovascular disease among them is almost non-existent. Now you have the Hadza, who are a hunter-gatherer tribe in Tanzania, with, again, almost no incidence of diabetes, hypertension, 1% population incidence of chronic diseases. If you come to us in North America, the incidence is closer to 15%. And by the time we hit 50, majority of us have strong markers, arterial calcification of chronic disease. And what is it that is unique? We in lifestyle medicine highlight 6 pillars. And they sound simple, But really, this is a complex interplay and dance between our genetics and the factors. So what are this? What we eat, how well we move, how we sleep, deep restorative sleep, how we handle stress, how we have community, deep social connections, and what toxins we put into ourselves. On the surface, sounds simple. And again, if you go to most doctors, they'll tell you, yeah, do this. The challenge is, leaving med school, I'm given a prescription pad, right? But in lifestyle medicine, our pad is the 6 pillars. We talk about them, we reemphasize them, we give you the support to implement them. Now, will everybody not take medications? Not true. There are some who do need medications regardless. But the key here is we reduce the pill burden and the medication burden. And what we aim to do is what we refer to as squaring the curve. So you live a long, healthy life, and at the end, you have a dignified exit. What we unfortunately experience today in the West is we have a long progressive decline. So the last 10 to 15 years of our life, we are living, well, we are alive, but we're not living, right? We are racked full of disability and racked full of chronic diseases. And it is assumed that's the norm. The reality is it isn't the norm. It shouldn't be. Those communities I mentioned, what happens is if you survive infant mortality, which unfortunately is high, and if you survive violent or infection, which is unfortunately, again, the reality in those environments, then your likelihood of living to be very old and still be very vital is very high. So if you see some of the documentaries online, on YouTube, the BBC crew went to the Simani Reserve, and they were struggling to keep up with Martina, who on paper says she's 84. We are not sure what her age is, but according to government records, she's 84. And she was carrying a bundle of plantain on her. She was strapped to her neck. I estimate that will weigh 10 kilos easy. And she was tearing through the jungle. And the crew were saying, can you please slow down? And I'm talking 30-something-year-old men struggling to keep up with that lady.
Wow.
That's the kind of vitality that is available to us if we really lean into and embrace these lifestyle factors. The challenge is those people, there's nothing special about them. Their environment is matched well with their nature. We have created an environment that actually pushes us to make different choices and makes us ill. But we also have the unique advantage that if today I fall and break my hip, I could be taken to the hospital, boom, done, surgery, I'm good. If I get an infection, antibiotics, I'm good. And there's very little likelihood of violence. So what we do, what makes us ultimately ill is what we self-inflict. And that is what takes away that squaring off, and we have that slow decline. So we have the unique advantage of being able to live vital very long, majority of us. Not like those people who have an environment where the high likelihood of dying from an infection, high likelihood of violence. And if you survive those, then yeah, you could make it. Majority of us here have that. Now, the issue is how do we get that out to the population and say, hold on, your genes are your risk. Just like you and I, Gary, if we go to buy a Ferrari, they'll look at us and say, yeah, middle-aged professionals, yeah, you'll be okay. The insurance will be low. If our kids who are in their 20s go to buy a Golf, they'll look at them and say, dangerous young man, insurance right up. But it doesn't mean that we are the reasonable drivers. The kids might be the reasonable drivers. It's just risk. But unfortunately, we live in the perception that, oh, poor me, it's my genes. Not quite. And that's what we want. That's at the very high level. It sounds simple, but it's very, very, very sophisticated.
Well, I mean, like this sounds really interesting. I think it would appeal to a lot of people to have healthy bodies, want to live longer, and just have this other concept of living better without medication.
Absolutely.
Right?
So I'll jump in very quickly before that. So you said wanting to live longer. We already live longer. But we live with disability. So a lot of us exist, but not live.
Yeah.
We want to have health span, and that's what we
Right.
work with people to achieve.
Okay.
Yeah.
Right. Right. Interesting. Like, what kind of led you to become a medical doctor in the first place? And even to specialize in lifestyle medicine.
Right. So interesting. I was born and grew up in Nigeria, in Africa,
Okay.
and choice to become a medical doctor is almost cultural. Okay.
Okay.
If you happen to be the smartest kids in this groups, you tend to be self-selected to either go into engineering or medicine or accounting or law. And there are three of us in our set who became physicians purely because we were the top few students. And the guidance and counseling tutor basically said, put medicine. My second choice was accounting, my was architecture, and my third choice was economics.
Mm-hmm.
So medicine, I am. So the first few years of my life, I was like, okay, yeah, I'm enjoying this. It's a lot of variety, enjoyed it. And then started residency in Nigeria, then moved to the UK and carried on residency in family medicine, understanding that as a family physician, you do that
Mm-hmm.
cradle to grave is relational, and you look after, I would say, 90% of the kind of things that come through the door.
Mm-hmm.
Lifestyle medicine is an interesting one. So in Edry, around 2012, the community decided they want a hospital,
Mm-hmm.
and a few of us were co-opted to join this group that worked with the community. And we were able to bear it upon them and say, look, what you don't want is a hospital. A hospital is a sign of a failure. You do want an acute care facility that looks after people who get acutely ill. Unfortunately, that happens. But
Right.
by the time you fetch up in hospital, it means the system is not working. We want to keep you out of a hospital.
Right.
And where do people do most of their life? In their community. So how about we make Edry the healthiest community in Canada?
Mm.
And that was the concept. And so explorations were done, and the Blue Zones concept was identified. Blue Zones was started by Dan Buettner, who's an explorer, and in collaboration with the National Geographic. And actually, Edry started moving towards that and brought
Mm.
in the concept. And unfortunately, COVID hit, the project ran out of funds,
Mm-hmm.
and it didn't take off. What it did to me, though, was expose me to that powerful concept and say, hold on, there are 5 places on this planet where you find a 90-year-old living at home, no dementia, independently. And
Mm-hmm.
some of those places are in very advanced economies. In fact, in the US, in Loma Linda. And you're like, hold on. And these people, different ethnicities, different socioeconomic class. So it's not as though it's anything to do with. So it became so powerful. So it got me curious. And I started looking, and lo and behold, it is the American College and the International College of Lifestyle Medicine, which was
Mm-hmm.
just exploding.
Okay.
Now, membership, oh gosh, we're in the tens of thousands, North
Mm-hmm.
America alone. And it's open to all healthcare professionals. And so you get this increase in membership, and it's just simply taking off. So more and more physicians. I believe in Alberta, we're about 20 board certified lifestyle physicians. So I'm
Okay.
dual board certified in family medicine and in lifestyle medicine. And you're getting more people getting into that. And it's open to all specialties. If you're health related, come along. And
Right.
it's just a movement that is taking off.
So it's really been a mind shift change in wanting to be healthier through lifestyles,
Absolutely.
yeah. So that's very, very cool. Yeah. Well, I mean, what kind of sets you apart from the competition? Well, what comes easy to you that others find challenging?
I believe I'm passionate about this and have
Yeah.
lived it, and I live it.
Okay.
All right.
Right.
So, being able to experience that, I'm going to give some personal information here, but I believe it will help people. I carry the gene called apolipoprotein A. So, I'm tending to produce to a higher risk of cardiovascular disease.
Okay.
So, once I have that knowledge, what can I do? Through my lifestyle, I can control my cholesterol. Or the option is I go on cholesterol medications. I was also pre-diabetic and pre-hypertensive. And through embracing my lifestyle principles and understanding how they work, I've been able to bring down my numbers to within a very, very good level. So for instance, my LDL cholesterol, the last time I checked, it was about 1.6. The recommendation is to be below 2. And we do know, based on science, if I'm going to quote a former president of the American Cardiology Association, who says, if your LDL is below 2, you can smoke, you can sit on the couch all day, you can have hypertension, you will not get a thrombotic heart attack or stroke because the building block doesn't exist.
Oh, wow.
Okay. So the building block is the LDL. And through lifestyle, I've been able to get my LDL down. And through that, of course, my blood pressure normalized, my diabetes risk normalized. I live that. And so when I talk to patients, I'm telling them I know. And I understand the science behind it.
Right.
Right. So those things are the most powerful medications.
So is it difficult to implement, maybe changes type of thing, to get to, to look after yourself, that way, to be healthier?
Yeah, absolutely. So again, I would say we have that internal knowledge of how the current system is set up and it works. So it is difficult. I mentioned that those two, I'll call them traditional societies, have the environment nudging them to do things. We have the opposite. Our environment is set up to make us sick, not intentionally. Well, some of it intentionally, but majority of it is not. We mean well, but unfortunately, there's a mismatch. So it is difficult. So, for instance, if you want to walk, in many communities here, they're not walkable. They're designed around the automobile. So it becomes easier to not exercise and take public transport. If you go to Vancouver, your likelihood of walking is higher because, again, public transport is a bigger setup there. And you have to walk to the bus stop. And then, again, the food industry knows how to hack us. Unfortunately, we are hacked and we just don't even know. What was designed to help us survive in an environment of scarcity is the very thing that is being used to make us sick. Because the food industry's motivation is to sell and to make money. And so they play on our very survival design. So for instance, again, Gary, I live in Alberta. In winter, I can go to the grocery store and buy a tropical fruit. And that's not bad, but it's unusual. But push that to the extreme. You only find sugar and fat in one place in nature, and that's our mother's milk. You don't find it anywhere else in nature. So we are naturally designed to like those things, especially in that combination. So what is ice cream? Sugar and fat. What is latte? If you go to one of the coffee shops, sugar and fat. If you get something like the caffeine is also addictive, so sugar, fat, caffeine, you're hooked. Right?
Right.
And you're loading up on calories. The other side point of this is, in the past, food gave us feedback. You've eaten so much. Today, what we call food is designed so that we don't get feedback, so that you can eat 5,000 calories in a drink without even knowing you've consumed 5,000 calories.
Oh, yeah.
Right? And our body is designed to hold on to calories because we couldn't get enough. So, all right. So I've given you two examples. Movement is engineered out of our environment. We meant well, but we've engineered it out of our environment. Food has been twisted against us because of the capitalist system. Right? Sleep. So I'll quote the MD, the CEO of Netflix, who said sleep is the enemy. So they want our eyeballs, our attention. So what do all these companies do? They again engineer it so that we are distracted and our attention
Right.
is dragged. So we end up not sleeping or we
Yeah.
don't sleep properly. So there's so much in our environment that is working against us. So yes, I may want to get healthy,
Yeah.
but it's a really uphill task. And that is part of it is getting people to begin to understand this gentle nudges in our environment
Mm-hmm. Mm-hmm.
that has that impact. And then with the support, we can begin to turn people around. Yes, we do use high level sophisticated precision things like we do genomics for those who are not responding well to certain interventions or medications.
Mm-hmm.
We do other things like organize an analysis of the gut microbiota so you know what kind
Mm-hmm.
of bacteria you're carrying and the impact they have. And we do those. But on the broad surface, these things are here, and those are the things that you need to look at to work on.
Mm. Very, 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 very interesting ideas like that we're discussing here. Well, I mean, what kind of tips or suggestions would you give someone who wants to be more successful?
So again, it depends on what you call success,
Right.
right?
Yeah.
Because again, in the capitalist sense, is accumulating, but also recognizing that majority of what we need, we have. So it's having that
Mm-hmm.
abundance mindset.
Mm-hmm.
That's the first step. And having the abundance mindset begins to set you apart. So you're not dragged into the mindless race that you accumulate and then you see the person who has more than you accumulate. So having
Right.
that slows down. And the interesting thing is that abundance mindset also translates into health. So if today I accumulate and by age 50 I have a first heart attack, and
Mm-hmm.
by the age 65 I can't function, I'm
Mm-hmm.
limited, then how
Mm-hmm.
successful am I?
Right.
But on the other hand, if I have an abundance mindset and I'm still going along at age 80 strong, I'll
Mm-hmm.
tell you a story. I met this guy, made such a big impression on me. I met this professor emeritus when I was working in Calgary briefly. He was still doing research at age 92 or so at the U of C. Mind is
Wow.
sharp,
Yeah.
he's
Yeah.
still in medicine. But more interesting was he was going hiking with his daughter who is in her 70s in the
Mm.
in the in the Rockies. Now tell me, which is success?
Yeah.
Academically, he's way up there. He's a
Yeah.
physician. He's still
Yeah.
got his health. He's still
Yeah.
got his faculties around him. Has he accumulated vast empire? No, he hasn't. But
Mm.
does he lack anything? Absolutely not. He's got it all.
Mm-hmm. Nice. Yeah. I mean, that would be pretty awesome to have that kind of, health span.
Yeah. Right? And it's doable for majority of us. It is very doable. In fact, I say we have the unique advantage of straddling both worlds because with the knowledge we have and
Mm-hmm.
the technology and care we have, you can have a prolonged health span. There are people out there who are living it. What we need to do is to make sure there is a bigger majority that are
Mm-hmm.
living that life. So
Right.
instead of spending a lot of money managing chronic diseases, we should spend that resource in improving people's health span.
Yeah. Yeah. Very cool. What would you say, like, what's one of the biggest challenges that you've had to overcome in your career, and how were you able to turn that into a positive?
I think I was burnt out as a family physician on the
Mm,
treadmill of just
mm,
looking after acute illnesses and chronic diseases and people not getting better. And that was when I recognized that, hold on, I'm not helping these people. Myself, I'm not well. I
mm-hmm.
wasn't well mentally,
Okay.
I wasn't well physically, and neither was I helping my people. And getting that recognition was a powerful jolt that
Right.
made me step back and then being able to pivot and do lifestyle medicine. I come in today daily with the vitality of saying, hey, let's work with people who are interested in this. And
Right.
these are people who self-select, right? They come to us knowing that, yeah, this is what we want to do. And let's work with them to identify the barriers and challenges and work with them. And it is so powerful when you see people's life turn around and you could see that benefit that they begin to experience, right? And that is what drives me. And looking back to where I was, I recognize that I don't want to be there anymore.
Mm-hmm. So that was a real turning point in your life, like
Yeah.
from family medicine and having some sort of burnout, and then I guess reconfiguring yourself into a lifestyle physician.
Yeah. I'll say, yeah, recognize it. On the outside, it looks like, oh, he's doing great. I looked the picture
Yeah.
of what a successful professional was. But on the inside, I wasn't. And again, recognizing that allo medicine is not serving our people. So I'll borrow the example a respected leader in lifestyle medicine used. Dean Ornish has published multiple research on lifestyle medicine. And he says what we're doing today with our current healthcare is tantamount to somebody whose sink is plugged and is overflowing. And instead of unplugging the sink and closing the tap, we keep mopping the floor.
Mm-hmm.
And it's a very powerful picture. You can mop the floor after you stop the leak, but no, we are not. We continue to let the tap overflow and we are mopping the floor. Little wonder that our system continues to just sink and sink and sink. It is scary. Now we're getting young people developing cancers that were considered cancers of later years. And it's not, we don't have to look far. We don't.
Right.
Our genes hasn't changed in one generation. Our genes are very much the same.
Right. Yeah, I mean, it sounds like things are going really well for you and your business. You know, as a busy medical professional, you know, a lot of time is spent actively working and working with patients. When looking towards the future, many don't want to have to be working so hard to create income. So some look at different ways of creating income and profits outside of actively working. You know, things like investing in stocks, bonds, crypto, or using a financial planner. What are your thoughts about ways of creating income outside of your work and active business?
So, twofold look. Again, what I do now, I don't look at it as work so much anymore. It's something I enjoy doing and it brings me a revenue. So do I foresee myself doing this in one form, way or the other for a long time? Yes. I may not do as much as I'm doing now, recognizing that, yeah, I want to explore the world. I want to go out there and live and give. And so, yes, I have recognized that. And yes, like most people started an RSP some years back and contribute to it on a regular basis. I do use advisors that are linked to my bank. And I did dabble in doing it myself a little bit. And yeah, I got and when I say double, I did buy some stocks myself and bought some did very well, but some didn't do very well. And then I looked at my RRSP and when the market crashes, it just wobbles a bit and then continues. And I thought, you know what? I'll leave it to those who do this for a living.
Oh,
the
yeah.
fees, I pay a close look to the fees they charge, but I recognize they are better at it than me trying to do it. So yes, I do recognize and contribute there.
So it's important to think about and have a plan, work with advisors and professionals in setting things up for perhaps the future.
Absolutely.
Right on. As we're wrapping up our interview, what kind of exciting plans do you have in the works in the next 6 to 12 months?
Yeah, so I'm looking forward to going to the Malaysian Lifestyle Conference in October.
Oh, wow.
Typically, the Lifestyle Conference, there's colleges all around the world. And typically, we go to the US, which is next door. And I just came back 2 weeks ago from the Alberta Lifestyle Medicine Symposium and Conference organized by Burman University. And I'm looking forward to going to the Malaysian program. Of course, summer is coming. You do little trips here and there. We live in the one of the most beautiful parts of the world, and we just take it for granted. Just last weekend, I was coming back from the physician wellness retreat organized by the College of Family Physicians of Canada. And we had people from all across the country, and we were there, in Kananaskis country. And you listen to people and how they're in awe, admiring this. And you're like, yeah, this is my backyard. So yeah, I plan to go out on my paddle board a few times into the lakes and surrounding areas. I do enjoy road cycling. I'll be doing quite a bit of my biking over the next little while here. And yeah, but looking forward to Malaysia, really checking out how they do lifestyle medicine in Malaysia.
Right. Awesome. Dr. Gye, that wraps it up today. And thank you so much for your time and sharing your insights and tips with us. It was a real pleasure to have you on the show. And Dr. Gye, if people want to connect with you, what's the best way?
Well, I think just call my team. Our website is ab.clinic, but the easiest way is just pick up the phone and call 403-960-1234 and just speak to Sam. We have 2 Sams, and they'll look after you.
Right on. Thank you so much.
Awesome. Thanks very much, Gary.
Want to share your success story? Apply to be a guest at truenorthsuccessshow.com/guest. We'd love to hear from you.